We've been talking about Migraine Canada's new discussion guide, which is a tool that people can use to help collect information that will be useful in their next visit with a healthcare provider. And I've been walking through some of the different components of this tool and really highlighting why they're important. So another section in the tool talks about the stages of migraine. And some people may be familiar with this, not everybody is, but I always think of the stages as sort of a curve. So oftentimes migraine symptoms can start hours or days even before the peak intensity of the symptoms that are often most disabling to somebody. And this is our prodrome phase. The prodrome phase often consists of neck stiffness or pain, people will talk about, sometimes craving, some mood changes, sometimes increased sensitivity to light, fatigue. So these can be kind of nondescript symptoms, but can represent that early stage of a migraine attack being on the horizon. Then we have our aura stage. Now, about 25% of people who have migraine will experience an aura. We can talk about that in another migraine minute. Most commonly, it's a visual disturbance, but the majority of people with migraine don't experience aura. Then this kind of heads into what is sort of known as the headache phase or the more severe phase. Of course, it's not just a headache, light sensitivity, sound sensitivity, nausea for some people, dizziness. So it can be a constellation of symptoms, but that's usually that peak intensity. And then there's the postdrome. So the postdrome, again, can go hours to days for some people. Sometimes it's referred to as the migraine hangover. And this is when people can feel, maybe less severe, but still cognitively foggy, fatigued. They may have changes in their mood as well. And so they're not fully optimal. So when you add up all of the time that somebody may be on that prodrome, postdrome, along with the severe, there can be a lot of days that are taken out with some migraine symptoms. And in somebody for having frequent attacks, you can imagine that even in the lower grade symptoms, that can take up a lot of time. So the discussion guide will highlight some of these symptoms, and you can capture all of these, recognizable prodrome or postdrome symptoms as well, so that you can convey that to your healthcare provider.